Hello, everyone. Happy Salah celebrations. My name is Umar. Welcome to our weekly question and answer sessions on COVID-19, organized by Science Communication Hub Nigeria in collaboration with African Science Literacy Network, Trends in Africa, and African Archive. With us today, we have Professor Olayinka from Ahmadu Bello University, Zaria, and Dr. Ramatu Abdu-Aguye from FCT, Departments of Public Health. And the third speaker we have is Dr. Jamilu Nikau from National Emergency Operating Center. Let me briefly give you the backgrounds of each of our speakers. You are welcome to these studios for answering question and answer on COVID-19. We are happy that you join us. We have Professor Olayinka. Is a professor of pharmaceutical microbiology with Ahmadu Bello University, Zaria. His research interests includes antimicrobial resistance in important human pathogens, improving antibiotic use, and identifying antimicrobial and non-antimicrobial antivirals and biofilms agents of plant origins. You are welcome, Professor Olayinka. The second speaker is Dr. Ramatu Abdu-Aguye, who is a medical doctor with a master's degree in public health, specialized in field epidemiology from Ahmadu Bello University, Zaria. She has over a decade in clinical experience with hospitals under FCT Health Secretariat. She participated in disease outbreak responses across the country and helped in setting up FCT Public Health Emergency Operation Center. Dr. Abdu-Aguye served as a programs officer with AFINET Nigeria under its malaria frontline program. She is also providing support to the National Primary Healthcare Development Agency under the platform of the National Emergency Maternal and Child Health Intervention Center. She is currently with the contact tracing lead in the FCT COVID-19 pandemic response. You are welcome to these sessions, Dr. Ramatu. The third speaker we have is Dr. Jamilu Nikau, who is also a medical doctor and field epidemiologist, who also holds a master's degree in public health. He was involved in several disease epidemic responses in Nigeria and has served in National Emergency Operating Centers, EOC, for cerebrospinal meningitis, cholera, Lassa fever, yellow fever outbreaks. He is currently supporting the FCT COVID-19 surveillance activities. His main focus is in Nigeria's fight against malaria, where he is involved in development of policies, guidelines, and training materials, as well as other coordinations activities geared towards meeting the country's malaria's control targets. You are welcome to these question and answer sessions, Dr. Jamil. Thank you for joining us. For our audience, you can post your questions on our Facebook and YouTube channels. We will answer them after the Q&A sessions. So we are starting with Professor Olayinka let me call Professor Olayinka to answer the questions we received from the audience. What we have today is the questioner is asking, what is your view on the role of BCG vaccinations in ameliorating the incidence and severity of COVID-19 in countries like Nigeria?
Thank you very much, moderator. Welcome to everyone. The BCG vaccine is about 100 years old, and I believe some of us as adults must have taken it, and it was intended to protect neonates against childhood diseases, specifically tuberculosis. Well, a few studies came out looking after this COVID outbreak, trying to find a correlation between countries that have a mandatory neonatal BCG vaccination and the severity of COVID infections that they had. And they came out to say there is possibly a link. But as it is, there is no evidence that the BCG that is developed to fight TB actually protects individuals from the COVID disease. Presently, there are 2 clinical trials, trials that are specifically designed to actually see, to know cause and effect, to actually know whether there is a relationship, a direct relationship. There are about 2 going on to find out whether the BCG given to healthcare workers or people that are at risk of contracting the infection, whether it will protect them. So, going by what WHO has said, there is currently no link that BCG will protect individuals from contracting the COVID disease. So they are waiting for data from such studies so that specific decisions can be taken on that. Thank you.
Thank you, Professor Olayinka, for answering these questions. The next person we go on to Dr. Ramatu. He's asking, could it be possible to get COVID-19 through either saliva or mucus?
Okay, good morning, Umar and every other person present, and it's a pleasure to be here answering these questions. So the question says, could it be possible to get COVID-19 through either saliva or mucus? Transmission of COVID-19, as we know right now, is mainly through droplet infections. That is when a person who is infected coughs or sneezes, and the droplets land directly on someone who is close to him or her, and then the person can get infected, especially if it gets into the mucosal surfaces. Transmission may also be through indirect contact, when these droplets land on surfaces and an unsuspecting individual touches them and then uses the same hand to touch unprotected mucosal surfaces, such as the mouth, the eyes. But then, it suffices to say that we must be very careful, especially with procedures that may, or practices that may involve some exchange of saliva, such as kissing, and also if a mother, sometimes, especially in this part of the country, many mothers may take food to their mouths to chew and then give their children. If this mother is infected, she can easily pass the infection through her child through the saliva. And it's also important that if you come across somebody who is infected with COVID-19 or is showing symptoms, you should avoid saliva exchanging activities. So I think that should help to answer that question. Thank you, Omar.
Okay, thank you, Dr. Ramatu. I hope our followers are listening to the answers given by our experts. The next questions we go to Dr. Jamilu. What is the rate of testing in a day in a country or Kaduna state? Now, is it true that the current low reported cases of COVID-19 in Africa is due to the low testing rate?
Okay, thank you very much, Omar. Can you hear me now? Just respond if you can hear.
Yes, we can hear you. You can go ahead, Dr. Jamil.
All right, thank you very much. for having me. I'm back at Sanda to my Muslim brothers around the world. So maybe before I answer the question, let me just send another question to all of us. As we are aware, the government in Nigeria and across most states are easing down some of the COVID-19 related restrictions, the lockdown and other type of restrictions. But as we are seeing, the number of cases in Nigeria are still increasing. That means COVID-19 is still with us in Nigeria. So as much as possible, even though the government is trying to ease out this restriction, because it's also sustainable for us to have lockdown forever and for several months, we should act responsibly and also act smartly so that we should protect ourselves from this virus, because it's with us, people are getting infected and people are dying. And if we are careless, we can get infected anytime with this virus. So comment down to the question about testing in Nigeria in Kaduna State. The WHO Director General declared that testing. Therefore, testing is the cornerstone for COVID-19 response globally. Without testing, we will not be able to detect people that are infected, isolate them, and treat them appropriately, and follow up their contacts. In Nigeria, what the WHO recommend is that there should be mass testing in every environment, in every countries, every localities. In Nigeria, according to data released by the Nigeria Center for Disease Control, we've conducted about 45,000 tests, out of and then about more than over 7,000 people are positive. So the WHO recommends that the positivity rate, for that means the proportion of people that will be positive in the number of people that tested should be less than 10%. And in Nigeria, if you look at the number of people,
are you able to hear me?
Hello, can you hear me?
Yes, we can hear you.
Yeah, the number of people we have more than 70%, and that's the number of tests done. Out of these 45,000 tests that were done, about so many of these tests, so many of the patients, especially the positive tests, have undergone multiple tests, some 2, some 3, to confirm that they are negative or they are negative, or they are still having the virus before they are discharged from treatment centers. So in Kaduna State, for example, because he asked for Kaduna State, they have about 180 cases, and they've conducted just over 1,000 cases. And with that, even in Kaduna State, they have not met the WHO criteria of about.
So when the viral particle stays on the surfaces, an individual can come in contact with it, and through their hands, maybe transfer it. And if they touch their face, that is the mouth, the nose, and the eyes, they are likely to infect themselves. So this is why it is important for us to constantly wash our hands. And
so if I can continue, based on the information we have, Nigeria, I don't know, Umar, can you hear me?
We can hear you.
It is when and
can you hear me?
Yes, we can hear you. You can continue.
Okay, based on the data we have for Nigeria and Kaduna State, we are not actually testing. Our testing rate is suboptimal. We are not testing enough, and if we are not testing enough, we are not likely get the people that are infected, all the people that are infected, so that we can tackle them or address them appropriately. And also, if you look at our regional data, even though in Africa we are resource poor settings, but there are some African countries that are doing also very well, like South Africa. The testing rate, which globally is agreed to be like number of tests per 100,000 population. In South Africa, it's about 6.5 per 100,000 population. In Ghana, it's about 5.5 persons per 100,000 population. While in Nigeria, we're still less than 1 per 100,000 population. That means we need to do more tests so that we can identify people that are having a disease, and we can manage them appropriately. So the next part, the other aspect of the question, if it's true that the current low reported case of COVID in Africa is due to the low testing rate, it's possible. It's possible that because we're not testing a lot, we are not getting most of the COVID-19 cases in Africa. So what that means is that we should test more people, so that once we test, and also even if you test, maybe if you test a month ago or 2 months ago, that doesn't give you an immunity that you don't have COVID-19. So whenever you have maybe a contact with somebody that is a confirmed case, or you do something that is will make you in contact with the virus, you need to do more tests. So the more we test people, the more we get people that have the virus, so that we can identify all the other persons. So we need more testing in Africa and Nigeria and in all the states in Nigeria. Thank you very much.
Yeah, thank you very much, Dr. Jamil, for this insightful information. I think there is some technical issue from Prof. Olayinka, so we'll go over to Dr. Ramatu. We have these questions to you, Dr. Ramatu. What should I do if I have come in contact with someone who has COVID-19?
Okay, thank you, Omar, for the question. So just before I start, in addition to what Dr. Jamilu just answered, we would like to encourage everyone out there to get tested, because we have noticed that there's a declining rate in testing and many people are actually afraid of getting tested. But it's for us to be able to control the spread of COVID-19, it's important that we all get tested to know our status as quickly as possible. So now on to the question, what should I do if I've come in close contact with someone who has got COVID-19? So I'm going to answer this question under 2 dimensions. The first is, let's assume that you are currently standing right next to someone who just tells you, I have just tested positive for COVID-19. The first thing you should try to do is, as much as possible, maintain some distance from that person. Maintain a distance of at least 6 feet from the person as soon as you hear that that person has got COVID-19. I'm not saying run away, but maintain a distance of at least 6 feet. Secondly, ensure that you have got some barrier, like a mask. Both you and the positive person have got masks on, because once both of you have got masks on, you also minimize the risk of getting infected. Also, practice hand hygiene. While you are in contact with that person, you may have had a handshake with the person, or you may have exchanged objects, a phone or something like that. So immediately practice hand hygiene, and at that moment avoid touching any of your mucosal surfaces, mouth, eyes or nose. Now, the second dimension is this: if you have had history of contact with somebody who is positive for COVID-19, that is to say, you're not right in front of the person right now, but in the past couple of days, let's say 2 weeks ago, 10 days ago, 4 days ago, you had come in contact with somebody who has COVID-19, it's important to immediately start to self-isolate. This is because COVID-19 has an incubation period of about 2 to 14 days. So it's possible at the very moment in which you stand, you may not have any symptoms, but you may be incubating the virus. It's also possible that you may already be infected, but you're asymptomatic, that is, you are not showing any symptoms. And also, it's also possible that you may not have picked up the infection from the person during the contact time that you had. But it's important to self-isolate so that if peradventure you have picked up this infection, you are able to protect any other person who is around you. What we mean by self-isolating is ensuring that you keep away at a distance of at least 6 feet or more, which is easily for us who are, for many of our audience who's listening, that is like 2 arms length. Keep at least 2 arms length between you and the next person. Also, avoid being in crowded places. Ensure that you wear a mask when you need to speak to anyone. And also ensure that somebody else who is speaking to you is wearing a mask. Then you also want to practice cough etiquette. Let's say peradventure you had contact with somebody, and at this very moment you now have a few symptoms like coughing. What in my cough etiquette is cough into your elbow. Avoid coughing and sneezing into your hands, because your hands are high touch areas, and the hands are we have a lot of contact with surfaces and other people with our hands, and even our own personal items. So you cough into your elbow and practice strict hand hygiene. That is to say, you wash your hands frequently after conducting any activities, or use an alcohol-based hand sanitizer. You may also go a step further by ensuring that you get tested. If you had contact with anybody who has COVID-19, it's essential that you call the NCDC hotline or the state-specific hotlines, because they are hotlines and are specific to each state. You call those hotlines and ensure that you get tested. And it's best to test this timing around at least 10 days after having had contact with that person. I'm emphasizing this because early testing may provide you with some false negative results. You may come in contact with somebody who has COVID today, conduct a test right now, and your test may come out negative. But do not forget that we have what we call an incubation period. For most of our audience listening, what we define as an incubation period is the time during which the virus will come into your body, have enough time to multiply, and also to cause infection, and you come down with the illness. And this happens between 2 to 14 days, with an average of about 5 to 10 days. So it's important that after 10 days of contact with somebody who is positive for COVID-19, you ensure that you get tested, because the only way to confirm is by having a test. So I would like to call on all our audience that please do not be afraid of testing. Testing is free. Forget about all the rumors that are being circulated about the test kits containing the virus. This is untrue, and this is just a means to frustrate the efforts of the government. So please, very, very important, come in contact with somebody who has COVID-19, isolate yourself, practice hand hygiene, practice cough etiquette, and finally, please get tested. Okay, thank you very much. I hope this answers the question. Over to you, Umar.
The next questions will go over to Dr. Jamilu. How can I safely perform Eid prayers and Juma prayers without getting in contact with the virus?
Okay, thank you very much. Maybe if all of us can mute our mic, you can hear us better. So, how can we safely perform prayers and Juma prayers without getting in contact with the virus? Unfortunately, most of us have done our Eid prayers yesterday. So maybe this advice may not pick up for Eid prayers. Probably maybe if we still have COVID during the next Eid prayers, maybe in the next 2 months. For Juma prayers, it's something that in so many states in the other countries, the state government has given approval for Muslim principles to start conducting Juma prayers. So what can, not just Juma prayers, even the 5 daily prayers that Muslims do in the day, mosques are open now for prayers. So how can we simply pray in mosques without getting So first thing first, there are some people that we know that they are at risk of getting this virus, people that are above the age of 60, and people with pre-existing condition or underlying medical condition like diabetes, hypertension, cancer, heart diseases. So as much as possible, these people should avoid going to prayers centers, mosques, churches, or any other mass gathering, religious or social. They should avoid going to mosques. And also people that have symptoms, people that have fever that have cough, people with difficulty in breathing, as much as possible, they should avoid going to mosques. They should pray at home because they could have been COVID-19, which by going there and mingling with people, they may infect other people that are infected. And then as much as possible, at the prayer centers, the prayers should be shortened. If there's a sermon, maybe if the normal sermon is 30 minutes, so if the imam can shorten the sermon to be maybe 7 minutes or 10 minutes, so that there will be less time for people to be together. And also, as much as possible, the prayers should be in a place that has good ventilation. If possible, the prayers should be conducted outside in an open place. Maybe if there's a tree under beside the mosque, people can be praying there. Or in the mosque, it should be well ventilated. They should open windows so that there is cross entry and exit of air. And also, social distancing should be maintained in the mosque. If you look at the prayers that's happening in the holy mosque in Makkah, that's the Haram. If you look at the Tarawih prayers, you see that the people that are praying, the imams or the congregation, the sahu they did or the rows they make for prayers is not the conventional rows we do. They usually kept a safe distance of about 2 meters, as explained by the Ramatu. And also, there should be, let's say, control of the entry and exit of the mosque, so that whenever people are coming, they should either wash their hands with soap and water or with hand sanitizers. And also, maybe in a mosque, there should be a certain number of people that will be allowed to go in at a time, so that people will not be congested and put people at risk. Also, wearing of face masks or any form of face covering is very important when going to mass gathering, because there are some people that are infected that are asymptomatic, or people that are pre-symptomatic. And this, as we all know about the behavior of this virus, this category of infected individuals, even though they are not manifesting with any symptoms, can spread this virus, can infect others. So as much as possible, everybody should wear face masks and practice self-hygiene. And also, in the mosques, maybe after every session, prayer session, maybe after there should be disinfection of the places. All the door handles, any places that people touch frequently, door handle, mat, any place, the microphone, any books, or any surface on the mosque should be disinfected immediately after prayers. And also, as much as possible, people should be encouraged to come with their rugs. They should not use the mosque mat or carpet, because probably before they pray at that particular spot, somebody with COVID-19 may have entered and prayed there, and they are at risk of getting the infected. As we all know, the virus will stay on some surfaces for some hours or even for some days. So as much as possible, if you're going to mosques or any prayer centers, you should go with your prayer center with your prayer rug, so that you will not touch surface that are contaminated. Thank you very much.
Hey, thank you very much, Dr. Jamilu. I hope our followers and listeners have understood the answers provided by Dr. Jamil. The next we move on to Professor Olayinka. We have these questions to you, Prof. Is there a study showing effectiveness of chloroquine or hydroxychloroquine in treatment of COVID-19?
Thank you very much. I seem to be having some problems initially. There are a lot of studies that have shown that chloroquine might have some benefit. And there are also studies that have shown that chloroquine does not have any benefit in the treatment of COVID patients. Now, some of these studies, most of these studies have not used enough, do not have strength of evidence, if I can put it that way. Some are just small studies. Some actually just observed what has been reported. And in some of them, there are a lot of limitations. So presently, there are clinical studies, and WHO set up the opportunity for countries to join and have the body of evidence that can be used to make an appropriate statement on whether or not chloroquine and hydroxychloroquine, together with some other drugs that have been used, have a place in the treatment of COVID patients. The recent one is the French study that initially used a small number of patients. Now they increased it, but I think WHO is waiting for the evidence from the clinical trials that are going on, and Nigeria, like we've had, has actually signed on to be part of that clinical trial, so that we could have enough data for them to make a decision on whether or not chloroquine has a place in the treatment of COVID patients. Thank you all. Umar.
Okay, thank you very much, Prof, for answering this. Next, we will go over to Dr. Ramatu. I have these questions. Can I get coronavirus from food?
Okay, so thank you, Omar. The question, can I get coronavirus from food, is a very, very common question that lots of people have asked, and we'll answer it as such. So there is currently no evidence that coronavirus can be gotten from food, because the coronavirus requires a live human or animal for it to multiply. So it cannot be gotten from the food that we ingest. However, it's pertinent for us to note that depending on how the food was packaged, if we are taking food that is packaged in a, let's say, a can, for example, and you're collecting that can from someone who has coronavirus disease and has probably sneezed or coughed on that can, then there are droplets. So indirect transmission may occur. So you're not getting the coronavirus from the food, but you're getting coronavirus from the food packaging. And to ensure that this does not happen, when you're taking food that is packed, you may want to wash it. You may want to wash it outside of the can before you take that can. And also practice hand hygiene. Another thing we can also do is practicing food safety. That is, make sure that all animal products are properly cooked before ingesting them. Ensure that you wash your hands before preparing food, while preparing food, after preparing food, and before eating the food. And also make sure to clean and disinfect all kitchen utensils and kitchen surfaces before and after food preparation. Thank you.
Okay, thank you very much, Dr. Ramatu. The next question we are going to Dr. Jamilu. We have this question: what is your recommendations on the use of hand gloves and face shields by the general public?
Okay, thank you very much for the question, Umar. Maybe before I answer the question, let me just say one or two things on chloroquine. And as probably mentioned, there are several studies going on chloroquine. And the first study that actually raised interest on chloroquine is the French study that was done on less than 50 persons. And that study, it shows that it has some benefit in reducing, preventing death and reducing the intensity of the disease. However, because of the low number of subjects in that studies, further studies were encouraged. So, however, a study was published this week in Lancet journal, last week, in Lancet journal, and this is a very large study of it has about 90,000 subjects in that study, and it measured assess the use of chloroquine, either chloroquine or hydroxychloroquine, either alone or in combination with a macrolide known as azithromycin. And based on that study, the study clearly shows that people that took chloroquine either alone or in combination with azithromycin have higher chance of dying from the coronavirus than people that did not take the medicine. And also, the study also showed that people that took chloroquine have higher chance, have high incidence of a cardiac condition known as arrhythmias. So as much as possible, there's no evidence to say that chloroquine is useful for treatment of COVID-19. And even in Nigeria, the Nigerian Center for Disease Control has started a lot of caution to the general public that it should not be using chloroquine or hydroxychloroquine for prevention of treatment of COVID because it hasn't been found to be effective for treatment. And also, it can also be lead to death to individuals. COVID chloroquine or hydroxychloroquine is now only restricted for during clinical trials. There is a higher study going on known as randomized control trial. It's a high quality to show that it's really definitely whether it is really effective or not. So going back to our question on the use of hand gloves and face shield, if you go to the street now, you see so many people doing so many things. First, maybe talking about hand gloves. As we all know, there's no any public health authorities, either the Nigerian Center for Disease Control or the WHO or the USCDC or any other reputed public health authority that recommend use of hand gloves. And in fact, what all these authorities recommend, in fact, discourage use of hand gloves. Because once you have persons using hand gloves, you have four sources of security, and they are liable to touch so many surfaces that are potentially contaminated, and they put places where they can contaminate themselves, or they can contaminate where other people can touch. And also, people that are wearing gloves don't usually practice hand hygiene. So what is recommended is that when people are going to public, maybe supermarket or any public market or any other places, there's no benefit for them to wear hand gloves. However, the most important thing, the ones that we have evidence that is preventing us from preventing people from having COVID, is for them to be practicing hand hygiene, washing their hands with soap and water for about 40 minutes, and then the use of hand sanitizers after putting any surface, before going to the market and after going to the market, hand gloves are to be used by health workers in health facilities when treating patients with COVID-19 infection. And then for face shield, in fact, face shield is receiving, as you can see, there's so many things, people they see things on the internet. Whenever they see people wearing face shield, they will think that it's something that anybody can wear. Yes, face shield is very useful for the management of COVID. But however, it's reserved for people that are managing, or health workers, doctors, nurses, or any other health workers that are directly managing persons with COVID, because it protects their eyes and face from any secretion that may be emitted from persons with the infection. There's no benefit that wearing face shield can protect people in the communities from having COVID-19, and instead, if they didn't even wear it properly, it will give them a false sense of security, and then they may go and do so many risky things that may expose them from having the virus. So face shield is not recommended for people in the communities. And using face shield, and then if the public and public are buying hand gloves and face shield for their personal use, it will create a very big problem to the response, to COVID-19 response. As we are aware, because of the COVID-19 situation, there are so many there are shortages of medical supplies globally. So, and if everybody will be using hand gloves and face shield, reserved for healthcare workers, we may have IT shortages that will dispose our health workers, which may be catastrophic to the health society. Thank you very much.
Thank you very much, Dr. Jamilu. The next questions we will go over to Professor Olayinka. How will I work safely in my office now that the PTF has started easing restrictions?
Thank you very much. Now that some businesses are opening, the PTF actually came out with guidelines for employers and businesses in Nigeria. There are some things that they will need to do to provide an environment where that will be safe for the workers. Some of them are provision of hand washing facilities and sanitizers, ensuring that if you have a large number of traffic, you reduce it, checking, temperature check.
I think there is some technical error from the network, probably. I think we will move on to the next questions. Let me go over to Dr. Ramatu at this moment to answer us some questions.
Okay. Do you want me to take his own question or I should take my own next question?
Okay, these questions, how can I protect my children from COVID-19?
Okay. All right. So the protection for children from COVID-19 isn't that much different from what we do for the general public. But children are a very vulnerable age group because they are young and are prone to having some form of lower immunity than the general public. And again, we need to note that there's a peculiarity with children. Children are highly mobile, as in they once they go out, especially in public, they want to run around, they want to touch things, and it's actually very, very difficult or not as easy to contain them as it will be for adults. Notwithstanding, it's important that first of all we need to educate our children about COVID-19. They need to understand the facts, they need to understand how to protect themselves. Many children are aware of the word coronavirus, but many of them do not actually understand what it means and how they can get infected. As much as possible, as parents have a role to play, educate them, let them be aware of COVID-19, its transmission, and the symptoms. And in so doing, you must also let them know how to protect themselves. The first most important thing is hand hygiene. We have to teach our children that they need to wash their hands as often as possible, and we have to supervise them and ensure that they get it done. We need to teach them the proper hand washing technique because many children will just go, open the tap, run their hands over it, and as far as they are concerned, they've washed their hands. But as parents and caregivers, we need to teach them how to wash properly with soap and water for at least 2 minutes to ensure that their hands get properly washed. We may also want to provide them with hand sanitizers that they use once they're out there, either playing or when they have to resume school. But that's a very, very tricky one when they have to get back to school. But right now, as much as possible, limit the amount of play that they do. Let them stay indoors. So they should not go out to the play yard to play with their friends, especially if anybody has got symptoms. But if they don't have symptoms and they need to go to play out, maybe in a closed environment, you live in a house, maybe 2 apartments, and the kids play with each other, we have to first of all assess the risk. The children that are playing with, do they have a high risk of getting infected? Are they highly mobile? Have they been going out? And then we ensure that we protect our children very, very much by getting their hands washed. Educate them not to touch their hands or their mouths as much as possible. It's really very difficult when it comes to children. But with regular counseling and education, they tend to pick up on this. We also need to teach them cough etiquette. Ensure that if they have a cough or a cold, they'll get to sneeze into their elbows and not in their hands. And how to properly clean themselves after sneezing and wash the hands also. It's very important. And if for any reason we have to go out with them in public, we try to ensure, first of all, not to take them to crowded places and places like supermarkets, especially where lots of people are there, and then there are many touch surfaces where the children can touch and pick up the coronavirus disease from the surfaces. So avoid taking them out to crowded places. There's nothing wrong with taking a stroll in the evenings with them on the open streets, but avoid crowded places with children. And for those who are old enough to wear a mask, particularly from age 2, 3 upwards, wear them a mask, teach them how to properly wear and remove the mask, and ensure that they practice hand hygiene before and after wearing their masks. We also need to let them know that if they come across anybody who is coughing or sneezing, they need to stay away from that person. Children are very, very good at obeying instructions if they have been clearly spelled out. Let them know that do not go near anybody who is sneezing or coughing. Ensure to keep your distance, ensure to wash your hands, and these are the we can at least minimize the risk of infection in children. To minimize risk of infection with COVID-19 in children by ensuring that they do all of these things and that they are aware of the risks and are aware of the ways to protect themselves. Okay, thank you.
Okay, thank you very much, Dr. Ramatu. The next questions we got over to Dr. Jamilu. Can face masks alone prevent me from contracting the virus?
Okay, thank you very much. The use of face mask is one of the controversial preventive strategies for this COVID-19. And if you can remember, so a few weeks ago, so many public authorities, even the WHO and even the NCDC, are not recommending the use of face masks by the general public based on what the evidence that we have. However, many countries, including Nigeria, have recommended the use of face masks in public. So, what we've been creating since from the beginning, there are known ways that COVID-19 can be prevented. Use of by maintaining social distancing of about 2 meters, by hand hygiene, cough etiquette, and other things. However, it has been shown that the face masks can prevent certain respiratory infections, certain viral infection, especially if the person wearing the mask is having disease. Maybe if somebody is having COVID and is coughing, or the mask can be a barrier from the respiratory droplet from reaching other persons that may not be affected. However, if everybody wear face masks, it will provide additional protection to society, not just the person that doesn't have the disease, but also the people that have the disease. Because as we are well aware, about 80% of COVID-19 are either asymptomatic or having mild symptoms that are symptoms that people can easily ignore. In fact, but the USCDC said that about 35% of COVID-19 patients are actually about 35% of COVID-19 patients are actually asymptomatic without any symptoms, and the certain percentage of those COVID patients are pre-symptomatic. So wearing face masks by everybody will protect everyone from getting infection. However, wearing face mask alone can't prevent viral infection. In fact, it can even dispose because that Ramatu said, the face mask has to be wear appropriately. It has to cover the face and mouth, and also as we can see in the public, so people will just wear it and just allow them, they maybe wear it on their chin or on their forehead. Wearing face mask in that manner, it will not prevent you. It has to cover your face, your nose and mouth properly, and also you have to do hygiene before and after wearing face mask. It's after all those things that it can give you an additional layer of protection. However, face mask alone is not a good prevention method. We must adopt all measures that are not to prevent us from getting infection with the coronavirus. Thank you very much.
Okay, thank you very much, Dr. Jamil. The next question is still to you. The question is, can I put a face mask on my kids?
Yeah, thank you very much. Yeah, face mask is recommended for everyone. However, it's not recommended for kids, for children below the age of 2 years. We know children below 2 years have some difficulty in their motor function. They will not be able to do some things for themselves. And so wearing face masks to those category of children less than 2 years can lead to their suffocation. So it's not recommended for children less than 2 years. However, children that are above 2 years can wear face masks safely, and then the parents can teach them on what to do, on how to wear the face mask, high hygiene, and how to wear it. And if maybe they are feeling suffocated, they can wear it. Apart from children less than, maybe apart from children more than less than 2 years, there are certain category of people that should also should not wear face masks. People that are having some difficulty in their breathing should not wear face masks because it can lead to their to suffocation. Also, people with disability that maybe they don't have the ability to remove the face masks. Maybe if they are having some difficulties, and people that are very sick should also wear face masks because wearing face masks, one way or another, maybe if there's any problem, they won't be able to remove it. But face masks can be used by children above the age of 2 years, but certain category of people, including children less than 2 years, should not wear face masks to avoid suffocation. Thank you very much.
Okay, thank you very much, Dr. Jamilu. With this, we have come to the end of this week questions and answer on COVID-19. We are sorry for all these problems that we have with the network. Unfortunately, Prof is not around here. I think let me just go back to our audience to look for some questions. so that you can answer them. So I think we have only one questions for this week. Maybe you may need to share more light on these questions together with Dr. Ramatu. This question is coming from Felix. Considering the fact that there is still no cure for the disease, what is the rationale behind those who have been shown to recover from the disease? This we see always according to the daily reports by NCDC.
Maybe she has. Can I answer it? Maybe she's having issues.
Okay. Can I attempt to? No. Okay, Dr. Jamilu, please begin.
All right.
Dr. Jamilu,
I think
please answer the question.
Yeah. What is the rationale behind?
No, I'm saying you should answer. Go ahead.
Okay. So what is the rationale behind what? Behind those who, maybe what you say that what is the rationale behind showing us people that have recovered from the disease since it has been said that disease has no cure? So this is a very important question, and I think it's a very good question that everybody should be very clear about. COVID-19, as we keep on saying, there is no known cure to disease. There is no medicine that acts on the virus. Just like maybe malaria, if you have malaria, there's a medicine that if you took ACTs, it will destroy the parasite, it will kill the parasite in the system. If you have the tuberculosis, there are medicines that kill the bacteria from the system. However, we don't have a medicine that kills the virus. That's the SARS-CoV-2 virus that causes COVID-19. However, COVID-19 is a viral infection, and most viral infection are what is called self-limiting. Self-limiting is that our body has the ability, we have what is called immunity in our body. Our body has the ability to respond to infection or any other thing that is foreign to the body. So our body has the ability to produce what is called antibodies that will neutralize this virus. So in most viral infection, they are self-limited. So sometimes people die when maybe their body system didn't emit enough antibodies that will fight the infection. And that's why it's very common to see people. That's why most of the deaths occurs in people that have reduced immunity, people that have certain infection like diabetes, hypertension, cancer, heart disease, or elderly people. All these people are known to have reduced immunity. Their immunity or the ability to fight infection is not as strong as young persons, and that's why we see lower death among young persons. So yes, there is no known cure for COVID-19. However, our body have the ability to fight infection, viral infection, so that once the body produce enough white blood cells or antibodies, it will neutralize those virus, and the person will recover from the disease. Like there's so many common cold. Maybe a good example is common cold. When we have common cold or catarrh, it's caused by most common colds are caused by virus, and we have common cold. When you catch common cold, you won't have it forever. After some time, about maybe 5 days or 1 week, you get recovered. So COVID-19 is a viral infection. You have the disease, and then you recover from this. Only that COVID-19 is more deadly than common cold or other viral infection. Thank you very much. I don't know if the Ramatu have something to add.
Thank you very much, Dr. Jamil. Maybe Dr. Ramatu, do you have anything to add on this?
So Dr. Jamilu has said it all. It's a self-limiting thing many a times that it's viral, and the drugs just help to absorb. Yeah, so he has said it all, and nothing else to add. Thank you.
Okay, thank you very much. Thank you for having you here, and thank you for answering the questions. Thank you for your time. For our viewers, you can still still send us your questions. We still have the Hausa versions that we can still do tomorrow. You can still put down your questions that you have. And we are very sorry for the inconveniences we had during this week programs due to network issues. So thank you very much, Dr. Jamilu and Dr. Ramatu. With that, we come to the end of these programs. So see you tomorrow for the Hausa version. I'll say goodbye. Okay, bye.
Thanks.
Thank you. All right.